The first muscle we will be palpating in the sitting position is the upper trapezius. Our obvious bony landmark will be the distal end of the clavicle, and the neck. We'll be placing our finger right there in the meaty area of the shoulder girdle, and the motion we will be having her do is a shoulder shrug in that direction. So go ahead and lift up, and this one is kind of hard to miss. Lift up, it's a big, thick muscle. Lift up and relax. The next muscle we'll be palpating is the levator scapula. We call this the exception to the rule. We actually do not have you contract when we are palpating the levator scapula. Of course, the obvious bony landmark will be the superior angle of the scapula, so we will find the acromion process, palpate along the spinous process down to the smooth triangular space, and then palpate up until we feel the spine or medial border of the scapula disappear into a meaty muscle tissue. That we will strum it, knowing that the fibers run in this direction from the superior angle to the transverse processes of the upper cervical spine. So we just palpate and strum it. If we have her contract with a shoulder shrug, the contraction of the upper trapezius covers up the muscle and we cannot palpate it. So we palpate the levator scapula at the superior angle of the scapula with no contraction. Next will be the middle head of the deltoid, and our bony landmark will be the lateral aspect of the acromion process. We can palpate that. Here's the acromion process. I'm going to drop just distal to that. And the motion she will be doing is pure abduction. I don't need her to move a whole lot. All I need to say is don't let me move you, and I will push her back into adduction, and that will cause her to contract the middle head of the deltoid. Relax. Don't let me move you. Relax. Don't let me move you. Relax. The last one is the supraspinatus. The supraspinatus will be palpated. The landmark will be the spine of the scapula and superior into that supraspinous fossa. So we'll be palpating. Here's the spine of the scapula right here. Go into the area above this. Now the motion we will be having her do will be with internal rotation, or the thumb pointed into her body, and not pure abduction, not pure flexion, but at a 45-degree angle. We call that the scapular plane. We're going to have her push her arm out. I do not want her to lift her arm up. The difference is pushing her arm out, she'll stop right around 30 to 45 degrees. If she lifts her arm up, she'll go ahead and lift her arm up all the way. I do not want that. I want a strictly push your hand out. Push your hand out. Push your hand out. And somewhere between the first 20 to 40 degrees, most books will say 30 degrees, we will feel the contraction of the supraspinatus. If she goes higher than that, then the upper trapezius wants to upwardly rotate the scapula, and we will not be able to palpate the supraspinatus through the upper trapezius. So we just don't want that push out, first 30 degrees-ish. Push out, push out. Go ahead and push out and relax. Push out and relax. Push out and relax. And we should be able to feel that through the upper trapezius.